Hi, this is Dr. Sindura, consultant obstetrician gynecologist and a laparoscopic surgeon at Arete Hospitals, Gachibowli. Today, let's talk about gestational diabetes, which is the most common and complication during pregnancy. It constitutes about 10 to 15% of all the pregnant women these days have this condition that they're developing, which is called a gestational diabetes. That is, they develop high sugar recordings during the pregnancy itself. So they might not have diabetes before, but the first time when they get their checkup done or during the part of their evaluation during pregnancy is when they get to know that their sugars are high. This is most common as it occurs because of the hyperglycemic state of pregnancy and also the insulin resistance that develops during the pregnancy. So, who are at risk of developing this condition? Mothers who have had a pre-pregnancy BMI, or the mothers who are on the obese side before they become pregnant, are the ones who are at risk of developing pregnancy, or the ones who have already had or suffering from polycystic ovarian syndrome, or the mothers who gain excessive weight during their pregnancy are at a risk of developing GDM in their pregnancy. If there is any family history of diabetes, are the ones who have a risk of developing gestational diabetes. Why is this gestational diabetes important? Because uncontrolled sugars are going to affect both the mother and the baby in adverse way, which can be prevented provided it is identified early and the treatment is taken in the right way at the right time. So what are the risks that are expected for the mother that in case she develops diabetes which is uncontrolled in pregnancy? Mothers always at a high risk of developing preeclampsia or blood pressure during pregnancy in case there's any association, or in case she develops diabetes in pregnancy. There's always a recurrent chance of having recurrent infections, recurrent urinary tract infections for the mother, and she's prone to have a risk of having a preterm deliveries because of these recurrent infections. And because diabetes results in macrosomia, in such a case, because of the obesity and the diabetes associated with it, there's a high chance that she'll have a complicated vaginal delivery or a cesarean section and associated morbidities with it. And what are the risk factors for the baby? In case the mother has diabetes, there is a high chance that the baby becomes macrosomic. Macrosomic babies are babies who are big in their size or large for their gestational age. So these macrosomic babies are the ones who are at a high risk of developing hypoglycemia after they deliver in the first few hours of their life, or they have a high risk of developing type 2 diabetes in their future. So it's always better to have your sugars checked at every trimester. In case there's any abnormality, please meet your obstetrician and take the right care. Yes, treatment for diabetes is definitely needed as soon as it is diagnosed. So, in the beginning, you will be advised regular exercises and dietary changes of avoiding frank sugars in your diet and sugar restricted diet. And your sugars will be monitored for the next 1 to 2 weeks period. In case, even after monitoring for 2 weeks, if the sugars are not under control, it's always advisable to start off medications. What kind of medications will you be given for a gestational diabetes in pregnancy? It's always better to take insulin as the treatment of choice, because it is definitely an injection which might cause a little more pain, but there are finer needles that are available these days which have reduced the pain drastically, as insulin is the best treatment for any diabetic mothers. So it's always better to prevent from having all these complications in pregnancy. So before you plan for your pregnancy, try and achieve a healthy weight, ideal BMI, and a well-balanced diet could prevent any mother from developing any of these complications. Thank you and have a happy and a healthy pregnancy.